Hi, it's Donna Ervin again for Nursing 11 Law and Ethics. And in this section of your reading, you should be further along, and we're at this section on page 6 of your syllabus where we're addressing the issues from the Board of Registered Nurses, starting with issues of abandonment of patients. So what does it mean for you to abandon a patient? So first, understand that you would have accepted an assignment, which means then you have a duty to take care of those patients within that assignment. Next, there has been a severance, or you have severed your duties, and you have not also notified the appropriate person that you cannot fulfill your duties to give them a reasonable time to replace you. So this can also be deemed as poor practice. Know that you cannot be held accountable if you are asked for abandonment, if you asked to do extra shifts and you're fatigued and you can't do that. Or you're trying to be forced to work a different shift and that's not a shift that you're familiar with, or once again you're tired and you can't perform those duties safely. That's not considered abandonment by the Board of Registered Nurses. Know that the Board of Registered Nurses does not have jurisdiction over your employer or over contract negotiations that might be affiliated with that employer. So that's where they draw the line. Factors that can be considered in regards to an abandonment issue is your knowledge and skill. Do you have enough training and background to safely take care of those patients? Are you healthy enough? Are you too fatigued where it would put the patients at risk and cause harm to them if you were continuing to working? Have you been oriented to the unit where you're being asked to work? So that's critical too. You want to be able to know where things are on the unit, how it's set up, and be able to manage your load. Availability of other staff to help you, support you, and have there been any considerations to try to get you to maybe to barter with another person to maybe pick up some care for them so they can do the things that maybe you're not trained to do. Okay, so those are items that you want to keep in mind. We're going to look at abuse and reporting requirements. You are mandated to report child abuse and also elder abuse when you learn of this, either indirectly, collateral information, but especially directly when someone tells you, I'm being abused at home, I've just been kicked and punched, I've got a broken rib as a result of abuse, you have to report that. Or I feel threatened, I don't feel safe going home, you have to file a report. And the process is that you notify your supervisor, have the appropriate documentation, and make sure you let that person know that you are filing a report for abuse on their behalf. If it's a child, then the authorities will take it from there, but you have to at least leave that message and file that paperwork. So what does abuse look like for children? They can have neglect, which can be basic neglect of food, shelter, clothing, medical treatment. Also, when they have severe neglect, they're malnourished to the point that they may need hospitalization or they may die. And then it goes into a criminal issue. For children, we look at who's responsible for the child's general welfare and well-being. Also for adults, we may have the same issues when it comes to elders. There may be physical abuse, they may be neglected to be fed, they may not be given proper medical treatment, they may be prisoners in their homes. Also, there's sometimes sexual abuse for children and for adults. And then you look at adults who have had maybe STDs, adults who have been given unwanted pregnancies and also been sodomized. We look at elders who have been tortured, had their finances taken from them, been held captive in their homes, sometimes by the hands of their own family members. And these elders come in, very disheveled, very unkempt, and just decompensated physically from not being fed and taken care of. When we look at them also, sometimes there is psychological abuse, and sometimes we just have to do what's right and make sure elders may be taken out of a home, maybe that they've lived in for ages because family members have misappropriated their funds or they've neglected them to the point that they've had sores or fractures. So moving on, we have explanation of the scope of practice, including standardized procedures. Scope of practice is important in determining, once again, the overlap of medical and nursing practice. and looking at standardized procedures. So it's not to confuse your nursing policies and procedures with standardized procedures. Standardized procedures, there's an entire format that you have to follow as far as developing these procedures along with the alignment of your medical board. You also have to have a whole team, including risk management, nursing, and other disciplines. You have to be clear and spell out the functions that the nurse is to perform, which nurses are going to be trained, and you have to actually keep logs of that training and the frequency of that training. You will also have to make sure you have scope of supervision, who's going to oversee it, and limitations on the settings or in the settings where it is to be performed. Also, record keeping and review. So these are part of standardized procedures. When you see those procedures that have come to pass, know that your nursing practice boards have a big role to play in that. Your Department of Health reportings and inspection requirements, you can key in California Department of Health, and they're actually diseases you are required to report. There's about 80 of them, and I'll just let you know a few of them, but this is actually California Code and Regulations, Title 17, and I apologize because I do think I remember mentioning on the other video that you didn't have to focus on that, but you actually are looking at it right now. So this is Title 17, Section 2500. Public health professionals are mandated to report diseases or conditions. So who reports? So we look at physicians, we look at nurses, we look at coroners, we look at dentists, nurse practitioners. These are people, clinicians, who actually are licensed to practice, and anyone in charge of a public or a private school, kindergarten, boarding school, labs, pharmacists, and even private citizens. You want to contact epidemiology or your infection control if you're at a hospital and you have patients that come down with different illnesses. We have to report at our hospital C. difficile, patients who come in with MRSA or VRE, and you know, the whole thing about Ebola, obviously. And then we have patients who probably more locally, you'll have staph infections that have to be reported, patients that have TB, patients that have PID, pelvic inflammatory disease, measles, mumps, tetanus, West Niles, Lyme disease, meningitis, pertussis. These are just a few that will be on that list. You're responsible for reporting if you have patients that come in with that condition or develop a condition once they're in your care. Frequently asked questions about pain. You should be looking at pain management, and know that the BRN feels that pain management is a part of your comfort care for your patients, and you have an obligation to make sure your patients are free from distress. So you want to advocate for your patients because this is deemed a standard of competence for your performance. And look at treating your pain effectively, assessing if the pain management regimen you have for your patient is thorough, or if you need to revamp it and alter it in some way to provide different alternatives to the current regimen of pain. So it doesn't have to be pharmacological treatment. It could be treatments such as heat. It could be also ice or cooling agents, or just support, massage, or just different types of manipulation. Sometimes stretching, different exercises can actually help with pain control. All right, so make sure that you try different measures for pain. Document what your patient says the pain is and where it is. Make sure that you look at things like the quality of the pain, length of time they've had it, what was the onset of it, what makes it worse, what makes it better, and then different treatment options that they have used to try to ameliorate or reduce the level of pain that they have, so that you may not be having to reinvent the wheel, or you may not try to pass something on to them that's not going to be effective. So you won't know that unless you get good history. Okay? Well, you were asked to look at, on the ANA website, a little clip about nurses in Texas, in Winkler County, Texas, at a hospital where they actually reported a physician for unsafe practice and they were fired. So understand that ANA plays a big part in whether or not you basically get fair treatment if you're called to trial. So look at this clip on these two nurses and see what you feel about the outcome of it. Know that nurses always advocate for their patients, and ANA will stand behind you for that. So ethics, I want once again to reinforce for you to go to the ANA website, go to Ethics, Ethical Issues and Resources. When you open that area up, you should see Ethical Challenges in the Era of Healthcare Reform by Dr. Vicki Latchman. Her second article you should have read by now is Applying the Ethics of Care to Your Nursing Practice, and you should have read Short Ethics Definitions. I want you to know about government agencies, understand what Medicare, Medi-Cal, and then also Medicaid mean to your patients, as well as Social Security. When you have people who are elderly or relying on the system because they're low income or they are of age and they have a certain amount of days that they bank per year, they may not want to stay in the hospital to finish their course of treatment because they're concerned that they can't pay for it. So they may actually leave abruptly or prematurely. And you may have people who will use all their time but still need to come into the hospital, even though they may have a high share of costs. So finances, plays a big part in our care for our patients. They may even have questions that they ask you in regards to, how am I going to pay for this? Can I speak to the billing department? What is my share of cost? These are questions that you can then turn over to the billing department, ask someone to come and speak to them about finances, and also ask your social worker to get involved to help rally for them, because there may be programs that will help them to shave off some of the costs that they really don't know about. There's a lot of services in the community. So one reason that we have you read about this is so you understand that there are programs available within each state to help people. However, they have to apply and they have to meet certain criteria, certain guidelines. And once they do become eligible, they still may have a little bit of the burden on them as far as cost factors, which may impact their desire to want to stay in the hospital if they know they're going to have a high share of costs. Okay, you should also be up on bioethics, understanding how medical conditions can have some ethical ramifications. And then in caregiving, if you look in the section of caregiving, there are wonderful resources available to people in your communities. What you're going to find out is, for example, you have Project Nightlight, which visits the dying, and it's an outreach and training program for people who want to extend themselves and provide care. You have Alzheimer's, dedicated to the research, education, and support of these patients and the caregivers that take care of them, as well as giving you 10 warning signs for Alzheimer's. There's another program, for example, called The Body, and it has over 30 HIV and AIDS organizations with hotlines available to people who need them, either patients themselves living with AIDS or the family members or friends who love and take care of them. So please stay up on your readings. I can't reinforce enough to you that these items that are being covered, you will see them again. You, once again, do not have to go detail by detail into every Nurse Practice Act that's listed here and know all the finite details of each one, but I do need you to know the main headings of them and understand how they fit into your practice. So we'll look forward to talking to you again on the next video, and be ready for the test that's coming up. Look at your syllabus, be prepared, and come to class having your reading behind you so that I can ask some questions and we can start dialoguing in class about some of your concerns and some of the things that might be of interest to you. So I look forward to the next video.